Hi, my name is Dee. I'm going to talk about the essential services of forensic nursing. One, monitor health. Forensic nurses assess physical and psychological trauma in survivors, tracking injury patterns, violence, and crime. They work in places like ER, prisons, crime scenes, and check on how people are doing physically and emotionally after the crime. They also notice patterns like if they recognize same type of crime keeps happening in the same neighborhood, they can help alert the community and plan ways to keep everyone safer. Two, diagnose and investigate. So forensic nurses identify, collect, and investigate injuries from criminal activities such as sexual assault and child abuse. So they don't just work with injuries, they also gather evidence that can be used in court and solve the crime. Three, inform, educate, and empower. Forensic nurses educate survivors, patients, and families about violence and abuse, offering prevention strategies and support. So forensic nurses teach people about health issues. They help survivors and their families understand how violence affects their health and what they can do to stay safe. They can also teach the public how to recognize signs of abuse and why it is important to notify the police or legal authorities if they see it happening. Four, mobilize community partnerships. So, forensic nurses collaborate with law enforcement, legal professionals, social workers, and community organizations to address violence and crime. They don't work alone, so they team up with police, lawyers, social workers, and community organizations to stop violence and crime. They might also work with shelters or mental health services to make sure survivors get all the help they need from different sources. Five, develop policies. So, forensic nurses contribute to policies and protocols that improve care for survivors, focusing on mental health recovery and evidence handling. Forensic nurses help create rules and plans to make sure survivors get the care they need, especially when it comes to mental health. They might also set up guidelines on how hospitals should handle cases of sexual assault, make sure everything is done correctly to protect the survivors.